You're now live streaming, Chair.
Thank you very much. Good afternoon, everybody, and a very warm welcome to the October meeting of the Wye Valley NHS Trust Board. To members of the public and staff who are taking the time to join us, we hope that you find the meeting informative and reassuring. As usual, we do encourage people to participate. We don't have any questions from public at this time, but we are always keen to receive feedback from colleagues as we strive to continue to provide the services that we'd want for our families and friends, and to spend our money as custodians of the public purse as widely as we can. So we have apologies from some board members today. Russell Hardy, our group chair, is not able to be here today, but in line with our agreed way of working, I'm Frances Martin and I am vice chair and therefore have the pleasure of chairing this afternoon's meeting. We also have apologies from Jane Ives, who colleagues will know is on leave this week at the end of her tenure as our managing director, and we look forward to welcoming Sarah Shingler, who starts with us next week. We also have apologies from Kieran Lappin, who's one of our associate non-executive directors, but thank you all the rest of you for being here. We've had a busy morning this morning in workshop, as is our usual way, and a number of themes that came from this morning's discussion will be picked up by colleagues this afternoon. Has anybody got any new declarations of interest, either substantively or in relation to this meeting? No, I will take the absence of hands as no new declarations of interest. So the minutes of the meeting held on the 4th of September, has anybody got any items for correction or addition? Katie.
Apologies, Chair, I've just spotted it. On page 5, under the finance section, on the second line, we talk about the reduction in agency spend, and it refers to 32%. It should be 3.2%. So we've missed a dot in error.
But it's amazing how important a dot can be. Thank you, Katie, for that correction. Any other items? No, okay, thank you. So the action log, there are two actions. An update on the progress on maintenance resolution by Mercia and Sodexo, and that is on our agenda for this afternoon's meeting. People may not be aware that items that are sensitive, commercial in nature or relating to individuals, we of necessity take in private, but we'll always bring back things that need to be shared with the public to a future public board meeting. So thank you for that, Alan. And the next one was the progress on the performance framework and planning cycle, and that is due to come back in December. So I think those were all of the actions. Thank you. So Katie is our Deputy Managing Director. So as we have the short interregnum between Jane's departure and Sarah's arrival, Katie, what would you like to pick out from your report for us this afternoon?
Thank you, Chair. So I'll take the report as read. It sets out in the usual fashion a range of current operational and strategic issues that I just wanted to brief colleagues on today. And firstly, around the oversight framework and our segmentation. So we've described previously that we were expecting to be in segment 3 for Q1 based on our performance, and that is now confirmed as expected. And it is helpful to see where we are across those range of metrics, and therefore the areas that we can continue to focus on, because we already are focused on them in terms of driving further improvement. And linked to that, we've undertaken the board self-assessment of capability, and that's further on the agenda for colleagues to review today. We were really proud and delighted to have been selected to participate in the National Neighbourhood Health Implementation Programme. I think it builds really helpfully on all of the work that we do already in an integrated way in Herefordshire, and partners across the county came together last week to really begin shaping our approach to that scheme. Another thing we're really proud of, our Community Diagnostic Centre opened this week, so it opened on Monday. We heard from colleagues in that division this morning around just the volumes of activity that have already gone through the unit. So we're really delighted to see the ambitions that the team have got for maximising the use of that CDC. And a really big thank you to everybody inside and outside of the trust that's played their part in getting us from idea through to operational building and delivery. In terms of winter preparedness, and Andy may touch a little bit on this later, lots of work ongoing around our urgent care pathways and really ensuring that we're ready as we head into the winter period, and we've been stress testing some of those plans with system partners. A part of that, we're gearing up, and indeed have started today. Many board members have taken the opportunity to have their flu jabs today, so I'd encourage all colleagues watching the board today to really take up that opportunity as we work our way around the organisation delivering that. In terms of the report, we also just focused this month on the performance and what's going on within our medical division. So lots of really positive improvements and activities in this division. We know that it's challenging in terms of urgent and emergency care with high acuity and high attendances, but the teams remain really focused on delivering improvements. And actually, we've been able to see some really positive improvements over the last couple of months and further plans for improvement going forward. Linked to heading into winter, lots of focus on reviewing our virtual ward model and the extent to which we can support improvements in that space through the winter period. And we've seen some real successes in our medical recruitment, particularly in our medical specialties, which will really help in terms of that sustainability of our services going forward. And finally, a really exciting piece around innovation, and it's a shame Jane's not with us today and she's on leave, because she was a real champion around our use of AI and those pilots, and the medical division has described in their update a number of ways in which they're using ambient AI, particularly with really positive effect. So watch this space for more on our AI journey.
Thank you, Katie. Any questions or comments for Katie? I know that many of those themes are replicated in the integrated performance report, so let's move to that. And what would you like to pick out for us before individual colleagues present their sections?
Yeah, thank you, Chair. So really the summary reflects a little bit on all of the areas of the balanced scorecard, as you'd imagine. So from an operational performance perspective, really focused on urgent emergency care and embedding those improvements. We welcome the support from NHS England that we've got through ESIST, and they're really helping us to look at that whole pathway, not just the front door, and Andy may touch on that shortly. And in terms of elective, we do remain concerned around 52-week performance by the end of the year, but we're really clear that we've got actions in place, and divisions were able to articulate those over the last week or so through our finance and performance executives. So we're confident in the focus on managing our long waiters from an elective perspective. From a quality perspective, our mortality metrics have worsened. This is what we expected to happen, and that's in part linked to the SDEC issue, where not all trusts are recording it in a consistent way. But we also know it's partly linked to some of our challenges with clinical coding and the action plans in place to improve that She's providing real leadership in terms of focus on. We're really pleased following our inspection with NHS England that our cleaning has been recognised as much improved. So a really big thank you again to colleagues and partners for your efforts in supporting that. From a HR perspective, sickness absence levels have reduced, which is really pleasing. Lots of focus in this area that Jeffrey may want to touch on shortly, and it does link back to the flu campaign and encouraging staff to take that up. In terms of encouraging staff further, I'd encourage all staff to take the opportunity to feed into the National Staff Survey. It's now live. Everybody should have had an invite to do so. And we really value the feedback that we get from our staff around their experience of working for Wye Valley. So I'd encourage all colleagues to spend a short amount of time completing the survey for this year, please. Thanks, Francis.
Thank you very much, Katie. Any questions for Katie before we move into the body of the report? No, all very clear, thank you. So Lucy Chizu, what would you like to pick out from a quality perspective?
Thank you, Chair. And Kate, I'm going to focus mainly on the front cover actually of the quality report, and Katie's already touched on a couple of those things, so I might be briefer than I thought I was going to be, but I do just want to touch on the cleanliness inspection again, if I may. So the Trust has been on intensive support, which is the highest level of support from NHS England in relation to our cleanliness standards and infection prevention control practices. We were visited at the end of May and moved on. Due to our improvements, we moved on to what's called enhanced surveillance. And we were really pleased with that at the end of May. And we were given an indication that our improvements were such that if we had sustained those, that when they came back in September, they were hopeful they would move us on to routine monitoring, which is the best place for you to be. And I'm pleased to report, following that inspection that took place in September, we are now on routine monitoring. NHS England are really keen that we maintain that momentum that we've had with our Sodexo and estates colleagues in terms of some of the life cycle work and some of the backlog of jobs on our help desk. So we will maintain regular check-ins with Sodexo to ensure momentum continues, and there will be a virtual check-in with NHS England colleagues and Sodexo in 3 months' time. And then there'll be a further inspection of our services in 6 months' time, just to check that we've maintained that level of achievement moving forward. Katie's already alluded to the seasonal flu vaccination, which commenced yesterday. Board members received their vaccination to demonstrate our leadership and commitment to the vaccination programme as winter commences. We do believe that we'll be able to get a larger uptake of staff wanting to have the vaccination this winter, just given we can return to a peer vaccinator model, which enables better access for staff, because we can take the vaccine to you rather than staff coming to the vaccine. We're currently working on the vaccination of those patients who might miss out on opportunities in primary care, either because they're in hospital for a long period of time, or if they're living in a care home or residential home, that they might miss that targeted offer that's offered by primary care. So we're just currently working on our patient vaccination programme, and that will be available for those patients who meet that criteria. I included just on the front cover this time something about our ward leaders development programme, and I've included it because we know that if staff are happy at work and staff are well led and looked after by good leaders, we know that patient care it will be really, really great too. So we've refreshed our ward leaders development programme, and it includes 4 aspects. So our ward leaders and team leaders for those areas that other clinical areas that aren't wards. Individuals be able to participate in the Leading an Empowered Organisation programme, which is a well rehearsed programme that's specifically tailored for leadership within health and social care. The opportunity for individuals to participate in action learning sets, buddy support from an experienced team leader or ward leader, and then specific targeted training, which is what I call an individual's virtual toolkit to enable them to be able to manage and lead their wards well. I allude in the paper just the publication dates of some national surveys, and our quality committee will be looking at those in detail in the coming months. And I also just include in the pack, but won't touch on it today unless anyone's got any questions, one of our quality priorities, which is around diabetes safety, which has 4 components to it, which is patient empowerment, safe management of insulin, the management of diabetic foot assessment and diabetic foot problems, and the management of hypoglycemic episodes. And the pack just contains information on the latter 2, that diabetic foot assessment and management of hypoglycemia. And as you can see in the pack, our spend on agency continues to progress in the right direction as the year progresses. I'm happy to stop there. I'll take any questions at the end, but pass over to Chizo now for mortality.
Thank you, Lucy. As Katie already alluded to, whilst our mortality indices are increasing, but our overall number of deaths have reduced over the same 12-month period. And as we've previously described, the discrepancies because of the removal of SDEC activity as part of our admitted numbers. But in addition, we also have the issue of uncoded patients, which has arisen because of vacancy in the team. We are working hard with the coding team. We've recruited more agency coders to ensure that we can clear the backlog and get us back on target. But I'm pleased to report that our mortality governance remains robust. There's a lot of clinical engagement, and in the last month we had presentations from our acute medical team and learning disabilities team to provide assurance of how they are learning from deaths. And earlier today at the board workshop, we had a presentation of how we are rolling out Martha's Rule, specifically the patient wellness questions, which helps us to pick up soft signs and are able to then pick up deterioration earlier. Thank you. I'll stop there.
Thank you, Lucy and Chizo, very much. Any questions or comments for Lucy or Chizo? No, very comprehensive reports. I'm not going to apologise for mentioning flu again. It will come up several times in the meeting today, but we ask for the support of our staff and our patients to get the vaccination right across the county and within our services as high as we possibly can. We do know that it is a very difficult time for patients when they are admitted to hospital, and we want to make sure that we don't expose them to additional viruses, and we want to be able to keep our staff at work to provide the care that we know that they want to and to look after their families and friends. So it is something that we feel very strongly about, and as Lucy said, we now have peer vaccinators, and therefore hopefully it will be a lot easier for staff and people particularly who work not on the main county hospital side or out of hours to get the vaccination. So we can get it to you. If you're not clear how to, then please do look at the internet, and it will be all the routes to getting vaccination will be there for you. I also wanted to pick up on diabetes, and colleagues may be aware that we have a monthly whole system, One Herefordshire quality forum. It's not a meeting because it doesn't have lots of papers and agendas, but it's an opportunity for staff across all organisations to share issues of clinical safety where patients are encountering different teams and different organisations, and diabetes is one of those. And it was a really positive and exciting discussion because the risks to people with diabetes from other complications are so significant. We need to make sure that staff are aware of those and trained and able to support each other. So some really good patient-focused whole system work that's going on around diabetes care. So I'm very impressed with that, and thanks to Lucy and Natasha and others for their leadership of that across the system. Okay, let's move on. So activity, Andy, what would you like to pick out for us?
Thank you. Perhaps it's Katie's already mentioned some, but I'll just delve in a little further if I may. Urgent and emergency care still remains the biggest issue that we face, and is the biggest factor keeping me awake at night. It's a #1 priority for us and for our patients and staff, particularly with the ongoing congestion in our ED and the ongoing additional patients across our wards and temporary escalation spaces. So a key factor, as you would expect, as we head towards what could be a difficult winter. Just if I may look at September, because it's hot off the press in terms of our emergency access standard and 4-hour performance, we delivered 66, just shy of 66%, which unfortunately was 6% off of our trajectory for improvement that we submitted at the beginning of the year. Number of factors impacting there, particularly the high number of emergency admissions, particularly compared to last September, and a marginally increased number of type 1 ED attendances, which had an impact on our non-admitted and admitted performance, both seeing roughly about a 4% drop. However, they do remain significantly better than where we were in Q1 when we were put into tiering because of our challenge performance. And it is good to see that some of our summer schemes through our Value in Patients Time workshops are still delivering, particularly in terms of that SDEC flow, our acute surgical units and navigation at the front door. But we know there's a lot more we need to do to increase our 4-hour performance and reduce our congestion and reduce our bed occupancy. One of the other factors that have impacted us in September is we've seen a significant increase in bed days lost due to delayed discharges, almost at winter levels, unfortunately, at certain weeks in September already, particularly for Herefordshire, but also for Powys, were both greater than last September. As We've already mentioned we've been placed on tier 1 for our urgent and emergency care standards, and that's with regular meetings with regional and national NHS England teams to ensure that our plans are robust. And we welcome the support, as Katie's already mentioned, of the Emergency Care Intensive Support Team, or ESIS, for the next 6 months, and we've already engaged early with them both, and we've had positive impact already of their expertise and knowledge at recent workshops we've held over the last couple of weeks, where we're focused on other key areas to particularly improve our admitted flow from our ED right through to the back door and discharge ahead of the winter period. Particular areas that we're focusing on is improving our navigation at the front door and SDEC, same day emergency processes, ward-based flow and criteria-led discharge, and some of our community schemes, particularly in some of the improvement schemes around Pathway 1 in Home First in Herefordshire, focusing on reducing long stayers for Home First and reducing the time for adult social care assessments and increasing therapy support. And also focusing our frailty bridging team on increased cohorts of patients through releasing their time for improvements in Home First capacity. We're also undertaking some learning events over the next few weeks as part of those Launch and Learn workshops, looking at having one of our geriatricians in our community integrated response hub to see what else we can do to improve our virtual ward ahead of the winter. Moving on to winter plans. Our winter plans have been submitted. They've been stress tested across the system and via regional events, and locally we have regular system-wide meetings with winter directors to follow up on those actions and learning that we've got from local testing and regional testing, and we meet weekly to progress updates. Locally at Wye Valley, our emergency preparedness team are using the experience of some of the scenario tests that were undertaken locally and nationally to stress test our own plans with our own teams at divisional level and with our on-call teams ahead of the winter, particularly focusing on our escalation plans with system partners. In terms of electives, really positive in terms of elective activity and elective activity delivery, our RTT performance and our productivity gains within months, and as Katie has already mentioned, our biggest concern there is our 52 weeks, particularly in some of our key specialties. We developed direct trajectories to recover to get to 1% of patients that are waiting no more than 52 weeks by the end of March, but positively, the risk cohort for those patients that will reach 52 weeks at the end of March across those 5 key specialties, we've taken 30% of long waiting patients off of those waiting lists over the last 7 weeks. So great progress already, and we're looking at how we can expedite that, particularly as we approach the winter months and the challenges that may bring. And as Katie already mentioned, community diagnostic centres opened this week, and I'd just like to echo Katie's thanks to staff, partners for a successful implementation of our community diagnostic hub on Monday. Thank you, Chair.
Thank you, Andy, very much. Any questions or comments for Andy? No, there's an awful lot going on, so thank you, Andy, to you and the team. I echo the thanks to the design, procurement, implementation, making it happen team around the CDC, and the board will be visiting individually and collectively. It's a really exciting innovation, and we are very lucky in Herefordshire to have this new development. So and an apology, as unfortunately we need to keep apologising to members of the public and our patients who have to wait too long either for a planned procedure or for treatment in our urgent and emergency care services. We are doing everything we can to make sure that we have capacity in the right place at the right time, and we ask for your continued forbearance with us. But if you do have an emergency need, to choose wisely and to think think about alternatives to our emergency department where they are more appropriate for your individual circumstances. And very grateful to our colleagues in general practice and other primary care services as we continue to focus on collaboration and sharing to make sure that we treat patients as quickly and as appropriately as possible. Okay, moving on. Jeffrey, what would you like to pick out for the board this afternoon?
Thanks, Francis. Well, our admin and clerical review program is well underway, and we should see the completion of phase 1 of that program come early November. So it's moving in the right direction. I mean, following the introduction of the revised sickness absence policy, we now have the lowest absence rates at the trust. We will continue taking the appropriate management and HR actions in supporting our employees, whilst also maintaining a reduction of sickness absence over the coming months. That remains a high priority area for the HR team. On equality, diversity and inclusion, we are determined to maintain a compassionate and inclusive working environment where everyone can fulfill their potential and be at their very best in a supportive working environment. We supported National Inclusion Week, and we are celebrating Black History Month and the Freedom to Speak Up Month throughout October, working with our staff side colleagues and our Freedom to Speak Up guardian and champions. Our annual Health and Wellbeing Week takes place next week with a variety of programs for our employees, supported by internal and external partners. And during the week, we will be actively encouraging all our employees to get vaccinated in preparation for winter. Finally, our workforce plan is on track, and we are actively encouraging all our employees to complete the staff survey. So the staff survey is now live, and we actively encouraging employees to complete the survey because we welcome views and opinions, because that helps us enhance the working environment and also the services that we provide to our patients. So we actively encouraging every single person to complete a staff survey. Those are the key highlights from our report, Francis. Happy to take any questions.
Thank you, Jeffrey. Any questions or comments for Jeffrey? No, there's some really good progress on a lot of those metrics, Jeffrey. So thank you to you and the team. I'd like to echo your comments about the staff survey. It is one of the most important pieces of information that we as a board use to gauge the temperature of our organisation. It is an enormous, there is a big correlation between how happy and how supportive and how enthused our staff are as to the quality of care that they can then deliver to our patients. So we absolutely want to hear from our staff how it is feeling. If there are particular things, we encourage you to speak up throughout the year. Don't wait for the survey, but it is an opportunity anonymously, and sometimes staff say, I've been chased to respond, and therefore it's not anonymous. The response process, the chasing process is anonymous too. We don't know who is making particular comments, but we would like a really high response rate, because that helps us enormously to make sure that we're doing the right things in the right way and at the right time. So ask for your help with that, please. Okay, moving on. Katie, what would you like to pick out from the finance summary?
Thank you, Francis. And so this is the finance update in the integrated performance report. As we've said previously, we go through in more detail through our financial recovery report, which meets monthly as well. And overall, at month 5, we are in a better position than we'd planned to be. So our deficit overall year to date is 2.6 million. That's around about £1 million better than we planned to be at this point in the financial year. So a really positive position in terms of the start to this financial year. And we've touched on a couple of aspects of that as we've gone through. So Lucy's mentioned agency spend, and in month we've seen a further improvement to 2.94% of total pay costs, and that's now below the national threshold and the benchmark at 3.2. So really fantastic to see that dip below that national benchmark for the first time, I think, in a long time. From a CPIP perspective, we are overperforming year to date, so we've delivered around £1 million more than we'd planned to in terms of efficiencies. A larger proportion of that is in sort of one-off non-recurrent measures than we wanted, so we planned for more of that to be delivered in an ongoing, sustainable way. So we do need to keep the focus on that as we move into the second part of the year. And we know in terms of our outturn position, there is a risk around CPIP. So although we're in a really strong place currently, and our plan was always phased for more of that efficiency plan to deliver later in the year as schemes like the workforce change programme that Jeffrey described come on board. So we do need to keep a watching brief on that forecast position. And although we've got plans in place, those plans aren't without risk. So we need to be really clear around mitigations where required if those risks start to materialise. In terms of activity and income, so our elective income, which is the bit that's primarily variable in our contract, is broadly on plan for where we need it to be. So that's really pleasing. The one significant area of risk within our overall income position remains the funding from Wales in relation to parity of funding arrangements between Welsh and English, and that remains with Welsh and English government for a resolution that does risk potentially the year-end forecast if not resolved. In terms of capital, no significant concerns to report here. We've done a bit of a review over the last week or so just to be clear on the forecast trajectory and our ability to deliver those national schemes that we've had funding for, and we're confident in our ability to do that. And cash currently remains in a stable position, but again, we can keep a really close eye on it, knowing that given the underlying financial position of the organisation, that remains a risk for us. Happy if there's any questions, Chair, to take them.
Thank you very much, Katie. Any questions or comments for Katie? No, we did have some time this morning in our board workshop to talk about the medium-term financial planning, but very reassured by this explanation and the in-year financial position to date and being ahead of plan. But our plans are backloaded and therefore the challenge gets greater as the year progresses. So this is a whole team commitment. Every single person in the organisation has some responsibility about how we spend our money, from the decisions as to which size syringe to use, to which test to order, to how long to keep people in hospital, as well as obviously some of the bigger capital and strategic investment decisions. So it's a really tight challenge that we're setting ourselves, and we know that if we are going to be able to move into a more favourable segmentation within the national process, then we need to work our way out of being in need of financial deficit support from NHS England on a recurrent basis. So really grateful for the hard work and the housekeeping, and particularly around some discretionary or some variable expenditure, particularly around agency staffing. So well done everybody, a really good position to be in at this point in the year, but the challenge isn't going away and we need to keep that grip and focus throughout the rest of the year. So grateful for your continued leadership for all of that. Okay, everybody happy to move on? So we now move into some items for approval. These three are all with you, Gwenny. So the Hoople board.
Yes, so these terms of reference have been updated. You can see the tracked changes, the updates there, they're not significant, and just to reflect the current ways of working, so they're there for approval.
Thank you. Nicola, you are our representative on the Hoople board and our chair this year. Anything you'd like to add to that?
It was mainly tidying up some titles and implications around director, non-executive director and council members who were sitting on the board. So it sort of tidied that up to cover the correct position.
Thank you. And for colleagues not as close to the Hoople organisation as obviously some of our board members are, it's a really important partnership and opportunity for us to provide services and work in partnership with Herefordshire Council and others in this separate entity that can act on our behalf. So thank you, Nicola and Gwenny, for that. If anybody is not happy to approve the revised changes, please will you raise a digital hand? Duly approved, thank you, Gwenny. And back with you for the Financial Recovery Board terms of reference.
Yeah, so these terms of reference were already seen by most, if not all, board members at the most recent Financial Recovery Board meeting. The Financial Recovery Board was set up just over a year ago, and the terms of reference have just been updated to reflect the ways that that committee has developed and is now working. So nothing terribly significant, just again tidying up.
Thanks, Gwynnie. And for staff and other colleagues, it may seem that the board, this meeting of an hour and a half in public once a month might seem very light touch in terms of governance assurance and scrutiny, but I hope by us sharing the terms of reference for other boards and committees that you understand that a lot of the work happens elsewhere, and non-executive and executive directors working together to be assured about how we are managing our services on behalf of the people that we are here to serve. So happy to, if you're not happy to approve the terms of reference, please raise a digital hand. Duly approved, thank you, Gwynnie. And then rather more substantively, the provider capability assessment. What would you like to bring to the board's attention?
So this is a new requirement that only came out, I think, at the end of August, and it's part of the NHS oversight and assessment framework. It's to keep this capability element separate from the performance element, but they're very much linked. We are required to complete this first attempt at the capability assessment by the end of October, so it can be reviewed by the regional NHSE teams, who will then provide a rating, which I've set out there. Going forward, this will be an annual requirement, but lined up with the annual planning and reporting cycle. So the expectation is that we'll need to refresh this around April time and then fit that into our annual approach going forward. So we'll seek to update it as we're going forward. I've gone through all of this with all the executives. The capability assessment is quite high level for the most part, and it's quite difficult to describe in there everything that the board does and the layers beneath the board, but we've put some high level information there. The first document is the self-assessment that needs to be returned, and which NHSE will review alongside other information it knows about us and decide which rating to give us. We are required to assess ourselves as partially confirmed or not confirmed in terms of being satisfied that we meet all the requirements. Having gone through all the lines of inquiry and indicative evidence aligned to each of the 6 areas, the executive team is satisfied that they're fully compliant with the majority and have suggested partial confirmation in relation to 2. One of those relates to health inequalities data. While there's lots of work going on in relation to health inequalities work streams, there are opportunities to improve the way in which we collect and analyse data more locally and internally. And also the other one is about meeting the standards, as we've just been discussing, about urgent and emergency care and 52 weeks, and the need to implement the plans we've got in place to achieve those by the year end. So the proposed submission is the first document. The second document has got the detail, which will go back to NHSE alongside this. It also sets out the evidence that we have available to support our declaration, which NHSE may request, but are unlikely to. In this process, they've got to review every single trust, and they'll be prioritising the trusts in segment 4 if they want to do any more detailed reviews. So seeking board approval based on this information here today.
Thank you, Gwynnie. Very clear explanation of this new process. Questions or comments for Gwynnie? No, so very grateful to executive colleagues for scrutinising this and giving an opinion. There's one minor typo that I spotted on the first document. The second, the quality of care segment, I think there's just a bit of copying and pasting. The first, so in the mitigating contextual factors, the yellow boxes, it's just a copy of the one above, and I'm not sure whether that should be in that box or not. I may have been misreading it, the first line, but we can talk about that offline. And I suppose that the wider question is so remind me of the deadline. So back to NHSE by the end of October, is that the plan?
Yes, it's supposed to be the 22nd of October. Ideally, if we needed extra time, we could have it, if we explained why, up to the end of October. They recognise that people's board meetings don't really line up to the short time windows that we've been given. Ours actually does, but if we need some extra time in order to go through this, then we could request it, but only to the end of October.
Okay, helpful. Stephen, I think possibly one for you. Are you happy to recommend that the board will sign off now, or to ask for any further comments back through you and Gwenny within the next week or so if anybody wants to query anything?
Yeah, I think if we could manage it with work that we've got approval, if there's anything that anybody comes in with substantive, we can reconvene and work around that. But if we assume it's signed off, but people do have a chance of them at me and Gwen, we can take it from there.
That's very helpful, thank you. But it looks comprehensive. The opportunity to hold the mirror up to ourselves and do the scrutiny, I think, is immensely important. So thank you for the hard work. So if colleagues have any substantive issues to raise, will you come back within the next week? But otherwise, we can arrange that that is duly signed and submitted on behalf of the board. Thank you. Okay, the next section are items for noting and information, and I will reiterate what I've said before. Some of these things have been thoroughly scrutinised in other committees, but in good governance and our spirit of openness and accountability come here for board sign off and oversight. So the first is the Trust Infection Prevention Annual Report. Lucy, is there anything you'd like to pick out for the board this afternoon?
Yeah, thank you, Claire. And I was going to say, I'm going to be very brief here, and I don't mean to be light touch on something that's so significant, but as you've already alluded to, as a subcommittee of the board, we have quality committee that looks regularly at infection prevention practices, policies, procedures, and then underneath that we have the Trust Infection Prevention Committee and numerous committees that report into the Infection Prevention Committee. What the annual report tries to do is pull all of that together into one document that just reflects back on the previous year's activities. And I think what the report demonstrates really is that managing and preventing infection is multifaceted, includes numerous stakeholders, and actually it's underpinned by good policy, good practice, good processes, and due scrutiny and oversight. And the report sets out how we achieve all of those things, and then also includes our performance against those trajectories that are set in the NHS standard contract. You can see in Appendix 1 the Infection Prevention Improvement Plan, which is pulled together in the context of our performance against those indicators, areas where we feel we need to improve, and any gaps that we identify in something that's called the Infection Prevention and Control Board Assurance Framework, which is a very detailed document that scrutinises all of our policies and processes. That's reviewed quarterly through Infection Prevention Committee and reported up to Quality Committee. You can see within that improvement plan that the majority are complete, are in progress, or are actually ongoing actions that we would continue to implement on an ongoing basis. You will note in the report, however, we are significantly off trajectory for Clostridioid infections, and that is also the national picture, and therefore in that respect we do participate in the integrated care system and regional collaboratives around reducing Clostridioid infection, with a particular focus on antimicrobial stewardship, prescribing and antibiotic selection. I'll leave it there, but I'm happy to take any questions from colleagues. Thank you.
Thank you, Lucy. Any questions or comments for Lucy? No, thoroughly scrutinised elsewhere, but the opportunity for 2 comments. Well done to you and the team for, as previously discussed, the change in our oversight from NHS England around cleanliness, and that requires day in, day out tenacious commitment to cleanliness standards from our clinical, operational, estates and PFI partners. So to everybody, well done, and keep that up. And also to avoid the spread of infection. So for people who haven't already got an appointment booked, do please get a flu vaccine, which will be available either through your general practice or where, if that is appropriate, but for all of our staff, as previously discussed. Thank you. Okay, moving on. Alan, what would you like to pick out in the mid-year review of our annual objectives?
Yeah, so for all of us, we're at the AGM last week, and as part of that presentation, you were seeing an update on our performance against last year's annual objectives. This is a mid-year review against this year's annual objectives, as developed by each of the execs that owns that particular objective. I'll take the report as read. Really, I was going to highlight achievements here and where more progress can be made. So there's two areas I'd highlight in terms of progress, and you won't be surprised by either of those. One is around urgent and emergency care, where our performance has actually deteriorated somewhat despite all the effort that has gone into that, including a massive programme of work over the summer around test of change, an awful lot of work going in around that. And Andy described a lot of that earlier, so I won't go into it. The second one is around neighbourhood health, and again, despite an awful lot of work that's gone into it, there's not been a great deal of impact. I think it will take time for that to come through around impact on acute admissions to the hospital. And obviously, as it says in there, we've now been chosen as well as a national implementer for neighbourhood health. Based on the good partnership work that we've done to date. So there's a really good story to tell there, but it's yet to make the kind of impact that we'd hope to see this year. In terms of some of the highlights, AI and particularly the adoption of ambient AI would pick out in here as something that we're doing very well on as a trust. And again, we've highlighted that in the past. Our delivery of our transformation programme and impact on for financial sustainability, awful lot of really good work around productivity going on there. And then also, it was mentioned earlier, but the opening of the Community Diagnostic Centre earlier this week, which was one of our big objectives, working on for 2 or 3 years, and opened on Monday. So I'll leave it there. Happy to take any questions.
Very clear. Thank you, Alan. Any questions or comments for Alan? No, reassuring that there aren't any surprises. So we obviously keep tabs on all of these things, but it's really helpful to have a mid-year stock take. So thank you for that. Okay, let's move on to the perinatal safety report. I'm delighted to welcome Justine Jeffrey, who joined us a few months ago as our Director of Midwifery. What would you like to pick out for the board this afternoon, Justine?
Thank you, Chair. So this is the perinatal safety report, for August. You'll see on the front page we're already making reference to some changes in reporting. So the point of this report is to provide that assurance to board that both our maternity and neonatal services are safe, and also ensure that we're meeting the requirements of the perinatal surveillance model. We have quite recently received an updated version of the perinatal safety model, which does indicate that should we want to, we can move to quarterly reporting, which we would recommend. And our LM&S colleagues are in agreement that we move to quarterly reporting for these purposes. I think what we also need to recognise within the report is quite cluttered with quite a lot of information. It is often quite difficult probably for board members to see what the report is trying to provide assurance about. So the new suite of reports that will come through will make that explicitly clear. So whilst there may be less frequency of reporting, there'll kind of be the same number of reports over the quarterly period. The only things I'd like to draw your attention to for August are there have been some more challenging staffing issues within the department across August, although I have to reiterate that the shifts have all been safe, but there has been a need to deploy staff more frequently than we would normally have seen to make sure that those areas are safe. And I think that's driven mainly by a slight increase in sickness across that period of time, because we have a tiny percentage of vacancy, probably less than 2 posts, and we are funded to our birth rate plus requirements, which is really positive. Unfortunately, you'll see within the report as well that we did report 1 stillbirth. Sadly, that case will be reviewed through the perinatal mortality review tool, and in the new perinatal incident report you will see the outcomes of those reviews at the private board going forward, and then obviously any themes of learning we will be able to bring anonymously through this board. From a training perspective, meeting our CNST requirements, we're on track to do that. We just need some support to release our anaesthetic colleagues to attend over the last few months, and we're confident that we will get them into those training sessions and meet that compliance. And you'll see there a couple of things from the Safety Champion walkabout in terms of we're seeing an increased number of women being referred to our triage department with non-pregnancy related issues, and we're also looking at the way in which we're managing some of our higher risk women in the antenatal clinic area, and that's all I wanted to draw your attention to for today. Thank you.
Thank you, Justine, very much. Any questions or comments for Justine? No, and again, well scrutinised through the Quality Committee, and I certainly would welcome a streamlining of the report, clarity over what's going where, to make sure the board is well and truly focused on the wood as well as the plethora of trees that come under this. Maternity and neonatal services have rightly been in the national spotlight because of some of the deficiencies that have been and the poor experiences that some people have experienced. We are absolutely committed to making our maternity and neonatal services as safe as we possibly can, and to be as open in the scrutiny that we're providing to that. So grateful to, particularly to Lucy and Sharon as our executive and non-executive safety champions, for continuing to focus with great compassion and determination to make that so. Okay, let's move on. So the next item is our charity trustee report. Grace chairs this for us. Grace, what would you like to pick out today?
Nothing to pull out to report to board, but happy to take any questions.
Thank you very much. Any questions for Grace? No, clear report, thank you for that. Then the Quality Committee, Ian, is there anything you'd like to pull out for the board this afternoon?
Nothing in particular, Chair, just to draw attention to the comment that's been made a number of times actually, that at Quality Committee we do scrutinise a whole range of issues in a lot of detail, and I think the summary report and the minutes give a kind of clear picture of that. Happy to take any questions.
Thank you very much. Any questions or comments for Ian? No, thank you very much. And then lastly in this section, the Integrated Care Executive Reports. Thank you for Gwenny for compiling this on my behalf. So the escalations reports from a couple of meetings. Has anybody got any questions on the Integrated Care Executive? No, so taken as read. Thank you. So that moves us, I think, to any other business. Do board members have any other items of business for our attention this afternoon? No, okay, thank you. And we, as I said at the beginning, we do invite questions and comments, preferably in advance, but if not at the time of the meeting. I don't believe we've had any for this meeting this afternoon in advance, but if there are any, then we will do our best to answer them. So we do welcome questions from members of the public in the future. So I think that brings us to the end of the meeting. Thank you all very much indeed. We next meet as the board of Wye Valley by ourselves on the 4th of December. We obviously have our foundation group board in November. So I think drawing the meeting to the close, I will just say 2 things to members of staff. Please do respond to the staff survey, and to staff and patients, do please think about If a flu vaccine is suitable for you, and for the vast majority of people it is, and do everything you can to keep yourself, your families and your communities safe. And we thank you for your ongoing commitment to providing the very best care that we can. So thank you very much. We will now adjourn for 10 minutes. So if we reconvene at 5 past to discuss items of a confidential nature or the board today. Thank you all very much.